political determinants of health kind of lend back to something that I've said many times, that the practice of medicine is a political act. The political determinants of health are really looking at government, policy, voting, and how it influences health equity. In the book, The Political Determinants of Health, it has this very powerful graphic of the political determinants of health and how things intersect and are connected. And so there is a direct connection with how our government works, how that influences policy, how that influences systems, how it influences community structure, and how that impedes and impacts health outcomes. So if you have the opportunity to work with pediatric patients, we know and we have ascribed to this determination that certain folks have a higher incidence of asthma, right? And we have ascribed it to something that is not genetic. So race, there is no gene for race. But because there's no gene for race and we're thinking it from a scientific perspective, what we don't ask is, well, why? What is the common denominator for some, not all, some of these children, these pediatric patients that have these horrible asthma outcomes, and they're more likely to die because of an asthma attack? Well, when you look at it, it's not race, but it is environment. And so some of those outcomes you'll also see those that are of lower socioeconomic status, regardless of their outward hue, and what we dub race or their ethnic group. But if you are poor in this country, your options of where you live are limited. And often in some of these communities where these poor children live, we have nuclear plants, we have waste that's being dumped into the air, into the water. There are housing codes that aren't always influenced and impacted in some of these lower socioeconomic neighborhoods. We're not thinking and going back to our own scientific training that children's lungs physiologically, anatomically continue to develop until they're 8 years old. So if you're from 0 to 8 influenced by poor air quality, we wondering why they got asthma, why they're dying from asthma. So all of that is interconnected because we're seeing it as, oh, well, we're just treating them for asthma versus saying, why are these corporations allowed to pollute certain neighborhoods? That's the political perspective and the policies of the communities we live and exist in, that as healthcare clinicians, healthcare providers, as PAs, we have to question the health outcomes and the health inequities of certain populations. And so we're not making that correlation of how all of this intersects and it impacts health equity and health outcomes. And because we are clinicians, we have to advocate for change, and we have the collective power to do so. There are 140,000 PAs. Come on now, come on. We have a voice and we have to use it.